The DocTalk show profiles Uganda's healthcare sector. Today on the DocTalk show, we profile the Uganda Cancer Institute. The institute's main block is located along Upper Mulago Hill Road in Kawempe Division in Kampala, approximately 2.8 miles northeast of the Central Business District. The institute has made significant growth strides thanks to the government of Uganda's efforts. From a mere unit in the 1950s to an independent institute since 2005. And today, Uganda Cancer Institute is proudly a center of excellence in all of East Africa, and it's considered Sub-Saharan Africa's most comprehensive cancer response institute.
The Uganda Cancer Institute started in terms of pharmacy. Previously, it was the nurses who were mixing and reconstituting the drugs, and were just doing them around just off the table. And of course, there were challenges of exposure and the safety. Whereas you know that the drugs of cancer are used for treating cancer. They not only treat cancer, but once you're exposed to them and you not have cancer, you can actually get cancer, on addition of other challenges like miscarriages, abnormalities that may come up. We thank the government because right now the Uganda Cancer Institute is autonomous and we are able to procure our own drugs. Procuring our own drugs, the interest was for us to be directly and closely to the manufacturer. Given the fact that these drugs are toxic and they have a very small window between the treatment and toxicity. So that means that any small error could affect, and that error, what we have done is that you need to communicate from the manufacturer so that you can follow up the trend right from manufacturing through transit to the patient. Now, that gap was missing because there were so many people who were involved in handling the drug. And that's why our storage conditions are very strict and stringent. We have monitors because we know our drugs are very sensitive, especially to temperature. Not any much different that even the other drugs elsewhere are also sensitive to temperature, but our temperature is a little bit different. For when we talk of the room temperature, it's 15 to 25. Whereas the other side, you can even go up to 30 when the drug is stable. Ours, past 25, you lose stability, and so the quality is compromised. And that means we are able to use the smaller funds that we have to acquire a little bit more drugs, and we have increased on our availability from what was usually about 60% to now about 80%. So that means there are more patients who are receiving the drugs, and the more patients who are actually getting all their treatments, where previously people could not complete their medications or their treatments. But right now, once a patient starts their treatment, they go through as scheduled and they complete their treatment. That's one of the greatest achievements we have had. Of course, we have gone with some challenges, which I think we are trying to overcome, because since we are dealing with manufacturers, once you place in your order, it takes about 3 to 6 months for your batch to be manufactured. And that means, this being our first year, we have had challenges in that, but we have now overcome that because we have now tried to get the lead time for ordering. And right now, as I speak, we are placing in our order for the next financial year. So come July 2019-2020, that financial year, our supplies will be coming in. Work together with other regional centers within the East Africa, so that we do what we call, we merge our quantities to ensure that we can meet the minimum order quantities of the multinationals, and that will lower down our price further. And there is what we call the PPE, the protective gear, that is the personal protective equipment, which includes the gowns. I think I will show you when we get to the constitutional room, so that you appreciate what it means, the double gloving and the masks. Now, all that is not to scare the patients, but to ensure that the person, the worker, is not exposed. We as the Cancer Institute, I think we have had some scenarios. Some of our staff have passed on cancer, and we are not yet so sure whether it was due to exposure, but because when you look at their family line, there's no linkage to the cancer. So the chances are very high that probably it was due to exposure. We have also seen this as evidence enough that within the same patients who come with a different cancer end up turning up with leukemia. And probably it's not because now of just leukemia coming from another cause, but now the drug that you're giving to treat the particular cancer causes another cancer. So that is evidence enough to show that the drugs you deal with actually can also expose you to the cancer. And in the same way, we are, I think, advocating and working together with the National Drug Authority and the Ministry of Health so that we can come up with the safety precautions on handling anti-cancers nationwide. In Uganda Cancer Institute, it is a public government unit which gives all services free to the cancer patients. So all medications that we give to the cancer patients are free of charge. Even when we got cost reduction, the cost reduction did not mean that we are now having the savings in money. The cost reduction means that we have increased in the quantities of availability. Whatever money we saved, we increased in the quantities. Where the items where we were receiving maybe thousands of a few, we are now in tens of thousands of those vials, and that has improved accessibility. We are now able to meet about 80% of our cancer patients. We are able to buy all the conventional treatments. Now, those are what we call now our essential, but the world is moving to the molecular side, the monoclonals. We as a government and the Cancer Institute, based on the budget we have, we are not able to meet the demands of such patients. And we hope that the government will respond to that. But at least we appreciate that the government has been supportive of the cancer patients.